I'm Megan Henderson. I'm the certified hand therapist at RPI Therapy. And right now we are working on a stubborn case of flexor carpi radialis tendonitis. It's the third most common tendonitis at the wrist. I see it a lot in people that have to do a lot of palm up lifting, a lot of fishermen. And the best thing to do for it, what we've been doing, is to really stretch. So the muscle, it attaches here, it flexes the wrist, it goes all the way up to attach at the elbow. And as you stretch that wrist back, it'll hurt all the way there. People that get this injury complain of pain with any sort of palm up anything. Carrying the grocery bags, little day-to-day stuff that involves the wrist being bent, especially when there's grip involved. And in therapy, we do a lot of manual for the tendon itself. We do a lot of assisted stretching because it doesn't feel good to do it by yourself, and sometimes it helps to have somebody facilitate it. We'll do ultrasound and we do conditioning with a weight. So lift slowly, lower. And while he lowers, I pull across that tendon and all the way up the muscle to improve the flexibility and extensibility of that tissue. Keep going. And back down. Now let's drop the weight and just stretch back. Let's get this out of our way for a second. I'm going to have you put your elbow on the table and just relax your wrist as much as you can. Ooh, that is tight. So right now we're doing joint mobilizations at the wrist. The wrist is made of 8 little interlocking carpal bones that fit together like a puzzle piece. They're surrounded by fluid to mimic like a ball and socket so that you can move in every direction. After an injury to the wrist or anything where your motion has been limited in one direction for a time, that's going to stiffen and those parts aren't going to move together so fluidly. So what I'm doing as he moves forward and backward, I'm giving opposite pressure. As he comes back, I force that first row of 4 bones towards me, just shifting, stretching. As he comes forward, I push that first row of 4 bones backwards towards him. Same idea. And if you can imagine all of those little bones in a fluid-filled sac, and the sac itself is tightening, to shift those bones inside it stretches that sac. That's what we're doing. That's a joint mobilization. So now we're going to do some ultrasound. Ultrasound is a modality that we use. Basically, the body absorbs the sound wave. Most people don't feel it at all. And the more collagen in a tissue, the better it absorbs the sound wave. So ligaments, tendons, it's really, really good for those things. Things like tendonitis, like this, benefit from ultrasound. And the body absorbs the sound wave. And what happens is it mimics the effect of heat. It's like a deep heating without the contraindications of heat, like inflammation, swelling, all of those kinds of things. I use it before mean hard massage and also before stretching. So for something like this, where that muscle gets really tight and sore and the tendon is really stiff, he'll have better mobility and better tolerance of heavy massage to that muscle after this ultrasound. So now we're going to do some electrical stimulation. We have different settings of electrical stimulation for different problems. The one that we're going to do right now, it's 4 tight muscles, basically. We use just 2 electrodes, put one right where that muscle starts, up towards the origin, the other coming down just before that sore tendon, and then we're going to pulse an electric current straight through that muscle. The idea being, if it's low level, it's this small contraction, you won't even see the hand moving, that's going to fatigue that muscle so that then again, in the rest of his day, he can move with greater flexibility. We'll use heat with that too to kind of add to the effect of this loosening, this relaxing. Let me know when you feel it, John. Arm up, thank you. Now you'll forget how mean I was. You'll be here for 15 minutes, it'll feel so much better, you won't remember I beat you up.